Operation Domination is underway. The ultimate game plan to dominate your NFL experience. With your hosts, Dan
you gotta be confident about your Achilles.
Jay Thornton,
Yeah, I mean, I got him at 2.
and Adam LaRue. Don't hope to be great and dominate.
Well, all right. Welcome into another edition of Operation Domination with another injury inquiry episode. It is week 8. We not only have Byemageddon, but we also have a ton of people that we have a lot of questions about heading into this week, just to make things really interesting. Like this season, and maybe we say this every year, I don't know. I can't remember. It doesn't feel that way, though. I feel like this season is really putting fantasy football owners to the test. How much are you paying attention? How good are your skills? Like, there's no luck involved here. If you're doing well, kudos to you, because it's been a challenging year between the injuries, and now we're deep into the hard bye weeks of the season. As always, I'm your host, Dan Mater. Make sure you check out Operation Domination on your favorite podcast app, and check out our video content when you go to the YouTube channel on the Fantasy Football Advice Network at FF Advice Net. I am joined by the one, the only, the great Dr. Brian Scott of Injured List Podcast. Brian, how we doing this week?
We're doing well. My roster is holding up pretty good. I gotta say, I'm very happy.
Just good for you, man. I mean, yeah. you are the injury expert, so you would know who to avoid, right? That would make sense.
And I do factor that in when I'm building my roster. I do factor that in. So
I would expect no less. I missed you last week. I was out on vacation. I'm glad you and the other guys were able to pick up the pace there for us. It was a great show. All right, so let's dive into this week, shall we? A lot of familiar names, some new ones, but we're trying to get the updates rolling in. So let's kick it off on the quarterback side. Lamar Jackson, hamstring. Is this the week he finally returns?
I believe we're going to see him. I think the plan all along, and we talked about this for several weeks, was to hold him out till after the bye, give him a time to rest, recover. It sounds like he's already returned to practice, maybe doing some limited stuff. He's not going to need a lot of time to get ready. Even from the beginning, it didn't sound like this was a really serious hamstring injury, so I think he's had adequate time to recover. I think we'll see him back.
So that's good news. Let me do a follow-up question then, because with Lamar Jackson, we do depend on his legs for fantasy football purposes. So do you think he will have all systems go given the recovery period that he had?
I do think we'll probably see him be very selective when he runs. He'll probably also be very protective of himself when he runs. He's going to take it easy at the beginning to kind of see where he's at. Because like I always say, you really can't simulate game conditions until game day. And that being the case, I think he'll be a little tentative early on in the game and not scramble unless he absolutely needs to. He'll get out of bounds. He'll slide. He'll do whatever he has to do to not injure himself further. So I do think early in the game, we probably won't see the traditional Lamar Jackson we're used to seeing when it comes to scrambling. But if he's able to test it out early and he feels comfortable with it, then we should see him return to himself. We won't know that until game time, but I can almost guarantee you that he will play and he will take snaps. And I just don't know how much we're going to see of the scrambling Lamar until he's had a few short little protective, innocent-looking runs under his belt to really test it out.
And that's fair. But here's the other fair point. I think a 75% to 85% Lamar Jackson is still more athletic than any other quarterback in the NFL. So he's still probably going to get his rushing yards. Maybe he doesn't pop off on the ceiling, but he does have a really nice match against Chicago, where the passing yards may be more available to him than they typically would be. Lamar Jackson, as long as he plays squarely inside my top 3 his first week back, I'm not holding back on him at all. Here's a quarterback that I talk about every single week, Brock Purdy and the toe. And now there's a lot of people reporting and talking about, why the toe has been so frustrating. Brian, I know you've been talking about it, but I just need to bring it up because I have to see if you have any update for me what's so freaking ever.
I mean, if they just listen to what I'm saying for the last upteenth weeks, they know that turf toe injuries suck. They're very debilitating and also very stubborn. It takes a long time to get over them, even if it's a quote-unquote turf toe variant. The only update here is really a lot of reports now are questioning the 49ers' decision to not put him on IR. And what I can say to that regard is all along they've said this is not a true turf toe. It's a turf toe variant. So it's some degree of an injury to the particular joint in the big toe. Not severe enough that it required surgery, such as Joe Burrow. However, significant enough that they wanted him to rest and get over this. However, we know, because he's already stepped back on the field with this, that he can play. It's just that you got Mac Jones, who's also injured, playing through injuries. And so, like I've been saying, they're going with the lesser injured of the two and waiting for Brock Purdy to be 100% recovered. But you still have him available, and that's why they haven't put him on IR. And we said it's going to be week to week, and that's literally all it's going to be. And unless we see Mac Jones go down mid-game with another significant injury or something that's going to debilitate him, we probably won't see Brock Purdy really be available until then, if that happens.
Yeah, I mean, until he's 100% healthy. I'm with you. As long as Mac Jones keeps playing the way that he's playing, I think they will wait until Purdy is actually healthy to put him back out there, as long as that remains true. I'm 100% with you on that. Now here's the fantasy fallout of it all. Last week, we saw the 49ers actually look like vintage 49ers. And the fact that they were able to run the football against the Atlanta Falcons. And as a result, Mac Jones, who had been a streaming option up until that point because of the ungodly volume they was getting that we weren't used to seeing in a Shanahan system, like 39 attempts a game, he didn't have that. It was more like what we're kind of used to seeing, 26, 30 attempts in that range. It's a tough matchup against Houston. I think it's going to be a low-scoring affair. If Houston's able to stop the run, then they might have no choice but to have Mac Jones throw the way he was throwing. But there's a wide variance going into this matchup with George Kittle back. It was clear the run blocking game was much more effective against the Atlanta Falcons a week ago. I expect them to try to grind this one out against Houston too. So my point in saying that is I don't believe Mac Jones, even in a week like this, is a streaming option you want to have heading into week 8. I would try to look elsewhere. Jayden Daniels, I mean, the news broke. He's already ruled out, but there was talk about, his hamstring's not that bad. We'll see. We knew the week 1 back from an injury like that was going to be questionable, but how long do you think he stays out with this injury?
I don't think it's going to be long. I think this is more a case of them protecting him from himself and not doing anything foolish and rushing back from this injury and potentially making it several weeks as opposed to 1 week. You could realistically expect that by the second week he could be recovered and ready to go if it's mild, as they say. So I would anticipate that right now, given the stage that we're at. The fact that they ruled him out early, I think, was them saying, "Hey, listen, pump the brakes a little bit, Jayden. You're a young quarterback. You've already missed a little bit of time earlier in the year. Let's hold off. Let's get you right. Let's not let this linger well into the season here." And it was probably more them being just extra cautious and not giving him false hope that he's going to be available and ready to go. Because what you don't want is for a young guy like this to then try to push it in practice and re-aggravate it and make it worse.
No, I'm with you. And he's already gotten banged up a few times. Last year, he missed a few games because of rib injuries and then wasn't as effective for a couple of games. This year, he's been dealing with a couple of different injuries now. So, I mean, you have to hold on to Jayden Daniels. He's too good when he's actually on the field for fantasy football purposes. But I do think this is something that might just be the case for this season. It's not a very good offensive line, and they're showing you, and he's getting hit. He doesn't know how to slide when he takes off and run. That was a knock I had against him ever since college. Marcus Mariota comes in. They're playing Kansas City, so it's not a spot that I want to run out and stream Mariota, even with his own rushing ability. I do think, like, for instance, if you were stuck between the two, I would choose Mariota over Mac Jones for this particular week. Garbage time could be available. Mariota does typically tend to take advantage of garbage time and has throughout his entire career. But it's not something, a direction that I'm looking to go to. We'll get to their wide receivers a little bit later on here. Bryce Young dealing with a high ankle sprain. So how do you think this is going to play out?
Well, it seems to me as though he's not going to be available this weekend. I know he was on the field. He was doing some stuff on the side of the team, and they're saying that he's probably going to carry a questionable tag into the weekend and he's day-to-day. But I have a feeling that they're going to probably hold him out at least this week and then kind of reevaluate and reassess early next week and see whether or not he'll be available. And going back a second, let's keep in mind, the Commanders don't have a bye till week 12. The Panthers also don't have a bye till week 14. So that very much plays into these decisions. You don't want to be, struggling to make it to the bye to give your players a rest. If you can buy them a week or two here or there, get them to the bye, then have them fully recovered, that's always better than trying to do what the 49ers are doing and make it all the way to week 14 with, 2 injured quarterbacks. So a lot of that definitely factors into the decisions that are being made here. And I think that's also playing into the decision with Bryce Young, keeping him out this week.
Here's the thing. I don't think this is a situation where the Panthers should be buying time. This is a situation where Bryce Young should just flat out be sat and not see him again for the rest of the season. Andy Dalton, look, I know if you guys have listened or watched this Operation Domination show, I am not a Bryce Young lover. Never have been, never will be, because he stinks. The proof is in the pudding. He's had 3 good games in his career, and he sucked every single one of them, and I was fighting against everybody who was trying to tell me that the small sample size compared to the much larger sample size we have in his career, because that was good, that was him turning around his career. Give me a break. He's been beyond bad this season. Beyond bad. Andy Dalton is an improvement, and I know that's not saying much, but he is an improvement for this offense and everybody else involved. Tedero McMillan has been unusable the past few weeks. Xavier Legette had a decent game out of nowhere. You can't trust Xavier Legette. Get out of here with that guy. There's another guy who's like a Fugazi as far as the sample size that you've been getting there too. Look, I know no one wants to hear it, but if you have Tet McMillan, if you have Rico Dottle, if you have Chuba Hubbard, hell, if you picked up Xavier Legette, hell, if you even have Jalen Coker as a back-end pickup now that he's back, you want Andy Dalton in the game, not Bryce Young. Remember last season, Bryce Young didn't get his job back because they just took it away from Andy Dalton. Andy Dalton was in a weird car accident, got an injury. That's why Bryce Young got his job back. We may never even have seen Bryce Young if it wasn't for that. So I wouldn't be surprised if we don't see Bryce Young again this season. I think the high ankle sprain knocks him out for a month and he gets the J.J. McCarthy treatment. Like, oh, wait, is your ankle still a little stiff? Yeah, we'll just keep you out because truthfully, we don't really want to play you. Speaking of J.J. McCarthy, you think he ever comes back from the injury?
Well, I think there were reports this week that said he's healthy and started practicing, but they're listing him as the emergency QB3. I don't think we're going to see him back, and I don't think we're not going to see him back because of the ankle, if that makes sense, what I just said. This is something that we didn't even know he had, and then all of a sudden, lo and behold, he's got a high ankle sprain, he's out. And then, we never saw him again. So I think that was the case. The excuse, we should say, to get him off the field. And I don't think we're going to see him back, barring any major injuries to the 2 guys ahead of him on the depth chart.
Yeah, it's like, look, kid, you're hurt. Wink, wink. Just go take a seat.
Shut up and sit down in the medical tent.
We're not trying to kill your confidence, so we'll just say you have an injury. But really, we want you nowhere near the huddle. All right. Anyways, let's move on to running backs. Bucky Irving still dealing with that foot and ankle issue. And yes, news already broke that he's going to be out again. Their bye is next week, I believe.
Yeah. We'll see him after that. I'm pretty sure of it. And this is, again, why I've always questioned why they never put him on IR. They could have made some roster moves and shored up that spot or done some other things to move some players around. For whatever reason, they decided not to do that. And lo and behold, now they're going to wait till after the bye, which is what most reports have been saying. And probably the wise thing to do here. He hasn't done anything still, I don't think. So he's going to need time to ramp back up. What he's been doing on the side, I'm not sure. But just kind of mind-boggling as to why they didn't put him on IR with multiple injuries, not just one.
No, and that's fair. But I'll make this point. And I could have made this point for the 49ers and the whole Brock Purdy thing too. This is a team that's really banged up, who has a lot of guys on IR. There's only so many IR spots that you can designate for return throughout the season. Some of that does come into factor, especially if you have a player that maybe has a chance to come back within around that 4-week timetable. Sometimes that plays a factor when you're as banged up as the Bucs are. And even, like I said, I can make the same case for Brock Purdy and the 49ers right now too.
Yeah.
Kendry Miller. So we know he's done. ACL.
Yeah.
Goodbye. What kind of ACL was it, out of curiosity? Do you know?
As far as I know, there hasn't been much detail about it. It sounds like it was a pretty straightforward one. It was not a non-contact one. So now, that being the case, you do worry about potential injury to other structures in the knee. The problem here really is timing. It's definitely going to go well into next season, his recovery. So we won't see him probably ready by preseason. I'd be shocked, to be honest, if we see him back week 1. He's probably going to start training camp on PUP, is my guess. And that's being generous. I know the timetable is usually 9 to 12 months, and 9 months, theoretically, he could be ready. I just think the way things are going last few years with how these guys are kind of taking their recoveries and stuff, I just think that year mark has become kind of more the gold standard nowadays.
It's a real shame because Kendry Miller was finally getting an opportunity to be something. I mean, Dennis Allen wouldn't let him be anything. And he was fine. He was looking like he was the better runner between him and Alvin Kamara at this point. Just as he's starting to establish a role, just as we were starting to pick him up as a flex play even, and then he tears his ACL. It's a real shame.
And Kendry Miller was a guy I featured on my NFL pre-draft injury special that I do every year. The year he came out of TCU, I think it was 2022. He had a history of knee issues dating back to college. You have to wonder if that maybe didn't contribute in some part to his injury now, but whether that be the case or not, here we are. And so, yeah.
Yeah. If you own Alvin Kamara, this was good news for you guys because, well, he was losing touches, and Kamara's not efficient as a receiver or a runner anymore. You still like him better as a receiver, but he's just not efficient in his game at this point in his career. So volume really needs to be key. And Devin Neal, at least to this point, has not shown any signs of being worked in by this coaching staff the way that they were starting to work in Kendry Miller. And I don't expect that to be the case. So Alvin Kamara does get a little bit of a bump up due to volume moving forward at this point. But that's about it. Nothing to ride home about. Maybe if someone's desperate running back, maybe take the opportunity to try to trade them if you possibly can. There are a lot of teams who are desperate running back, especially this week. I can't tell you how many teams in my leagues are rolling out like Woody Marks and Kyle Monungai because they just have no other running backs to even turn to. Everybody else is either hurt or on bye. Speaking of injuries, and I know this injury episode, but I'm looking at this list of wide receivers, and it's literally like a honey-do list that I get every weekend. It's long as can be. All right, so we got Nico Collins first, and this one's pissing me off. Concussion, what's the update that you have?
Yeah, he's in protocol. I don't think he's even done anything the last 2 days.
No.
Likelihood of him clearing concussion protocol at this point is pretty low. I think they've already said, a lot of reports that were saying that he's already kind of getting the doubtful tag, which means there's a 25% chance he's going to suit up. It's probably even less if you're on concussion protocol now.
It just really stinks when you get, it stinks when you get a concussion, period, but especially when you get it on a Monday. Because the odds are just real slim that you're actually able to clear all the stages that you have to clear coming up in that following Sunday. I mean, just like, it's bad enough that the Texans offense is just completely inept and that Nico Collins, who we know is a stud, can't quite get going because the offensive line and the offensive play calling is just terrible. And I do purposely say offensive line and offensive play calling. I am not one of these people laying the blame at CJ Stroud's feet. Yes, he has happy feet because he's getting killed and his offensive coordinator is a moron. Let's not lose perspective here. I'm sick and tired of seeing this like, oh, well, he lost it. He's not good since his rookie year. It's what happened to Mac Jones. Look at Mac Jones now. Oh, he's in a real system with a real coach. People are like, well, we want him as a starter now next year. All of a sudden he's got trade commodity. Just stop it. CJ Stroud is good. They need to fix the rest. Hopefully Nico Collins, though, can still salvage and become a wide receiver too. Not going to be the wide receiver you drafted him to be this season. I don't believe at any point in time because it's just that broken. But I do think with the volume he was seeing and his talent, he can still be a wide receiver too the rest of the way. Hopefully we'll get him back after this week and there won't be an injury that keeps him out for multiple weeks as we have sometimes seen concussions do in the past. Speaking of teammates, and we're getting alerts here. Speaking of teammates,
that might have been mine.
Good. Christian Kirk hamstring. Anything there?
Yeah. So some reports have said that this was an actual re-aggravation of a prior injury, and if that's the case, that's pretty bad because that means this could be extended time absent. I don't think he practiced the last few days. and it sounds like this could be a week-to-week thing. Not good. We talk about this a lot too on the show, Dan. The re-injury rates for hamstring injuries are very high in those first few weeks that they come back or that you're cleared to start playing. As high as like 20-some-odd% within the first, I think, 2 or 3 weeks. So it is a known problem and a known risk when you step back out on the field, which is why these hamstring injuries get treated so conservatively. And this is a classic example.
Yeah, if I remember correctly, I believe Christian Kirk had his hamstring injury pop up last Friday. And then all of a sudden he was inactive. That's why it was kind of unexpected going into the week. Here's another point. It just brings you back to the Texans. Here's another point about him. What did you draft 2 Iowa State stud wide receivers for if you just refuse to use them? I mean, Christian Kirk's out. Nico Collins is probably going to be out. And I still had to sit there and watch Xavier Hutchinson and Braxton freaking Berrios play ahead of Jalen Noel and Jayden Higgins. This week, one of those rookies is going to have to play because they play a lot of 3 receivers and somebody's got to be on the field. But their refusal to use these guys they drafted high to begin with is blowing my mind. But what would you expect from a guy who derives from a Patriot system in Nick Caley? What a moron. Anyway, so let's talk about A.J. Brown. And I wasn't going to bring this up. It doesn't seem like there's a ton of concern, but he did miss 2 days listed with a hamstring injury. So I thought it was worth at least mentioning, Brian.
Yeah, I think it is too, because I have him on my roster and he's been balling out the last couple weeks after a slow start this season, and some rumblings that he wasn't happy in Philly. But I think this is more of a precautionary thing. He's been playing well lately. I didn't see any effects of a hamstring issue last weekend. I think this is just more of a veteran precautionary move. Give him some time to rest. He might have felt some soreness in that hamstring, and they didn't want to risk anything. I guarantee you he's doing some work on the side, getting some treatments with the training staff. I think we'll see him, though, this weekend.
Okay, that's the good news there. Mike Evans, bad news. Oh, what a brutal thing. Comes back from his injury, his hamstring injury, gets back on the field, and just lands real weird, like on his shoulder, broken collarbone, calling it out for the year. So here's, give me a breakdown of the broken collarbone injury, but also, what do you think this means for Mike Evans' career at 32 years old?
Well, for one, it sucks because, he came off a hamstring injury, which I think he's actually dealt with the last few seasons. He might have been on our injured list a few times over the last couple of seasons with hamstring issues and various other ailments that have kept him off the field for one reason or another. And then goes down awkwardly on this attempted catch over the middle on a deep pass from Mayfield and lands not just on his shoulder, but on his head, has a concussion and a fractured clavicle. He's been banged up a lot. And the later you get in your career at this position, statistically, we know the chances of you participating the following year drop exponentially. So it definitely works against him. This is not necessarily a tough one to come back from because it's a upper body injury, and receivers are really dependent on their legs and their agility and their speed. They're going to fix it surgically, so it's pretty much guaranteed to heal by doing that. However, it means an 8-week absence at the minimum. So he's been placed on IR officially. They never said it was season ending. They said there is a chance that he might come back. I just don't think we're going to see it just because of his age and because of the amount of injuries he's dealt with over the years. It's unfortunate. This will certainly make a guy like him look in the mirror and really question his passion for the game still and whether or not he thinks he could compete at this level year after year.
Or even want to. I mean, we'll have to see. I do think we're going to see Mike Evans on a football field again. I don't think this is the last time we see him. And look, the Bucs are a team right now that look prime, like a prime candidate that could go into the playoffs on a decent run. And I could very well see him being back if they get into the second or third round of the playoffs. It's quite possible in this situation. But what I will say is I don't think, being that we're in week 8, you're going to see him be relevant for the fantasy football season. So I'm okay going ahead and dropping Mike Evans. I don't think he comes back any earlier to actually help you out. What the heck is going on with Chris Godwin?
I wish I knew. I haven't heard much new news, but I'm still sticking with my original theory is that he has some type of stress fracture in his fibula. They're saying not related to the surgery he had, but I think it has something to do with the surgery he had, because if they did put a plate or some type of hardware in there, sometimes you will get what's called a stress riser, which is where the interface between the hardware and the natural bone can sometimes cause a stress reaction or a stress fracture. Kind of came out of nowhere. Nobody really even can pinpoint whether or not there was a specific injury that caused this. And I'm sticking with that. They're saying week to week, and I think that's why. Is because of the nature of this injury. It's not necessarily something that requires emergent surgery or urgent surgery or immobilization per se. It just requires like monitoring and treating the symptoms and allows them to weight bear. Now, I don't know if he's been in a boot. I don't know if anyone's seen him on crutches or anything like that. I haven't seen reports of that. So I don't know what else it could possibly be, to be honest with you.
No, Chris Godwin's like, where's Waldo? Like, no one knows what's going on. All I know, he's got a fibula issue. What about that fibula issue? Can't find anything really about it. No one's really seen him anywhere. I don't know where he's at. I'm with you. I don't know if he's got a boot or a crutch or is he still here? Does he exist? Like, I don't know anything.
And they're saying week to week, which makes it sound like he's around, but yet no one can really put a pinpoint on where he is because he's not been at practice. So your guess is as good as mine about his availability, but I will say if it is a stress fracture, we won't see him until he's on the practice field. So until he gets steps on the field, you can consider him out.
It's just a real shame because he comes back, gets the 10 targets right away. Mike Evans has been out. It looks like Baker Mayfield's playing like an MVP candidate, and you finally have a wide receiver like, all right, let's go. You get 2 games out of him. Didn't do much for you in the production time that he did receive. And now we have a mystery injury that we really have no idea what the severity of it actually is. Emeka Egbuka owners, they're great with it because, hey, that means Egbuka just keeps being a top 5 wide receiver the rest of the way with no Mike Evans and who knows what Chris Godwin. It's not like Tez Johnson or Kate Otten or Sterling Shepard or Cameron Johnson or whatever no-name wide receiver you want to throw out there is going to do enough to really take any kind of volume away from him. All right, so let's talk about Garrett Wilson and his knee. This one sounds like a real questionable thing this week.
Yeah, I saw some reports that said he made it back to practice in a limited fashion and that they were holding out any type of certainty about his status until Friday's practice. I'm not so sure, though, we're going to see him still this week. The Jets have a bye in week 9. Why would you put him out there week 8 when you're 0-17 or whatever the hell they are? It doesn't make sense. I don't think
7 and desperate to do something positive. But
but he's not going to. He's not the difference maker. Unfortunately, that's going to turn this season around in week 7 or week 8 or wherever we're at. I think, and they got a week by 9. I think it doesn't make sense from a injury healthcare standpoint to put him out there for 1 week when you have a bye coming up.
Look, Garrett Wilson's going to get paid no matter what. If I'm Garrett Wilson, it doesn't make sense for me to come back at all this season with this team and the way that it is. I'll be like,
and that's another thing I was going to throw in there too. I mean, like, what do you think he's feeling? You think he wants to step back on the field until he's 100% at this stage? I mean, what he's probably thinking to himself too. Why am I going to go out there, go 0-8 and throw myself in harm's way just to appease the staff and the organization? I'll rest up and make sure I'm good.
He's still on his rookie contract. It's not like he has this like latent incentive type of deal to hit certain milestones and stuff like that. And like I said, he's going to get paid because we all know what type of young star wide receiver he is. So that's not even the question, regardless whether he plays or not. So I'm with you. There's not really a huge motivation, at least there wouldn't be for me, other than just wanting to play football because you're a football player. So very iffy situation. You're saying we won't see until his bye. I tend to agree. I think that makes a logical sense. I do want to mention this point about the Jets, since you're a medical professional and you probably appreciate this. And I guess I shouldn't laugh at this because it is injuries, but I had to chuckle. Every time Tyrod Taylor is about to be presented with the opportunity to be the starter, some sort of injury pops up. Now, it does sound like he's going to play and going to start this weekend, but it was like, yeah, Tyrod's going to be the starter. Woody Johnson slams Justin Fields under the bus, and it's like, oh, wait, Tyrod's got a knee issue that he's kind of has to work through here a little bit. Like I said, it does sound like he's going to play. If you're a Breece Hall owner, and I am in a couple of leagues, this whole situation's been just maddening because it's clear who the best offensive player on the field is for the Jets, and they just, refuse to give him the ball. I will say Tyrod Taylor playing, while it's not a big upgrade, probably is at least a small upgrade for Breece Hall because Justin Fields just doesn't have the track record of checking the ball down ever. Right now, you need Breece Hall to catch some passes out of the backfield because he's not being efficient because the running game can't block for anything, and everybody's just teeing off with 9 guys and 10 guys in the box anyway because it's the only thing the Jets can do. So Tyrod Taylor, I think, does help out Breece Hall a little bit, get those extra check down passes to maybe at least stabilize the fantasy football floor. They have a match against the Bengals. If he don't do nothing against the Bengals, I don't know what to tell you because matchup doesn't get any better than that. All right.
I just pray nobody jabs a needle in him somewhere and causes a pneumothorax like happened in San Diego, because that poor guy has had multiple things pop up when he's had chances to be a starter in this league, and it's happened time after time.
It's absolutely insane. Yeah. All right, so Calvin Ridley, another hamstring injury. I almost hate asking you about hamstring injuries because I know the answer is relatively the same, but we do have to talk about it anyway. So Calvin,
I know, and I feel like a broken record sometimes too, saying the same stuff over and over again. As far as I know, he didn't practice earlier in the week, and he's going to carry a questionable, possible doubtful tag heading into the weekend. This truly might be a game time decision. Look to see what he does on Friday, if anything. That's the best I can say without going into the hamstring jargon again.
Well, and here's the other problem with that is that being how bad the Titans are, Ridley's nothing more than a low-end wide receiver 3, even if he's 100% healthy. So I would be looking for other options, if at all possible, regardless of whether he's going to be active. I'm with you. I don't think it's going to happen. Washington Commander receivers. Well, we know we're not going to have Jayden Daniels. It's going to be Marcus Mariota. We didn't have either of the receivers last week in Deebo Samuel, Terry McLaurin. Do we get him back this week? Quad for Terry and heel still for Deebo.
Well, it sounds like both of them actually stepped on the field and started doing stuff. I think McLaurin actually got a full practice in, which is kind of surprising. I think I saw some video clips of him too, and he looked like he might have been favoring the right side a little bit. Whether or not that's the injured side, though, I don't know. But it sounds like he's ready to go, and it sounds like Deebo is also trending toward playing. They're saying that even though he missed a practice earlier in the week, it was more of a precautionary measure and that he's trending toward playing. I think both are going to be listed as questionable, but I think they'll both be suiting up and playing this weekend.
Look at that. Some good news finally on the wide receiver front. I know it took a while to get there, but we did finally get there. Playing against Kansas City with Marcus Mariota, I'd be surprised if you had a better option, Terry McLaurin or Deebo Samuel, especially in a week like this. However, I would still rank both of them, given the matchup, given they're coming back from injuries, especially McLaurin, who probably will need some time to get ramped up to get back up to snuff in any way, as wide receiver 3s heading into this week. So startable, but I wouldn't expect any high ceiling potential out of them for this week. Ricky Pearsall. Here's another player they keep telling me is day-to-day, week-to-week, and yet I still don't see him out there practicing.
Yeah, I don't see him coming back anytime soon right now. Not the way it's looked. Again, didn't step on the field. Haven't gotten much as far as updates about what they're looking for or what he's doing. But yeah, it's not looking good. And again, we talked about the 49ers. They got a week 14 bye. He's not on IR. And maybe this has to go back to what you were saying earlier about, limited IR transactions available to each team and personnel moves and stuff. But, this has been an extended absence already, and it looks like it's not ending anytime soon, unfortunately.
So it was a PCL injury. What is the typical timeline behind a PCL injury?
Well, it really depends on the severity and how much swelling there is in the knee, whether or not he's dealing with any instability issues. And that's really the big concern with PCL injuries, is if it does cause any stability issues, those are about the only time you'll see these get repaired or reconstructed. It's not like an ACL. It functions in a similar fashion, but it's not nearly as vital to the overall stability of the knee. And for that reason, a lot of times we can tolerate even full ruptures of it, assuming he doesn't develop any functional instability or clinical instability. So, and some of that's subjective, some of that's objective. It's kind of a mix of the two. But the thing is, until you get on the field, it's hard to really assess that from a subjective standpoint. So he could possibly just still be dealing with pain, inflammation in the knee that's really setting him back. And I'm going to kind of tie this into Malik Neighbors. There were some reports and things floating around social media, like, why hasn't he had surgery yet? We're almost 3 weeks after his injury here, and apparently he still has not had surgery. That's not unusual. When you have a major ligament injury like this, you'll get a lot of bleeding inside the knee. You'll get a lot of swelling and edema that builds up in there. And that can really hamper a player's ability to recover enough to go through the surgical procedure to reconstruct the ligament. And Ricky Pearsall could be dealing with something similar, even though surgery is not on the horizon. He could have quite a bit of an effusion in the knee, edema in the knee, that's causing him to have limited range of motion, pain issues. And that may be the thing that's preventing him from stepping back on the field. In Malik's neighbor's case, that's something that can severely be a detriment to his recovery if you prematurely rush him to surgery to fix that ligament when he's dealing with those symptoms, because that'll have a much more negative outcome in the long term. So some of the physicians, some of the practitioners will have the player or athlete or patient do some type of what we call prehab, where they're basically doing therapy in order to regain some of their motion, get rid of some of that swelling prior to the surgery, knowing that they're going to have to redo all that stuff again afterwards. But you want the knee to be in its ideal a condition before undergoing major ligament reconstruction. And so the Ricky Pearsall thing may be kind of similar to what Malik Neighbors is dealing with in that regard.
All right. That's the reason I asked the question, because now we're going on 3 weeks of him being out. And I just trying to get an idea of what the real timeline is, because the 49ers are going to keep telling us week to week, day to day. Yeah. We have no idea if that's actually true, because it's the San Francisco 49ers. So they lie all the time. Yeah. So it's fine. So I wanted to get an actual idea of what a timeline of that could be. I do think we're going to see Ricky Pearsall again at some point this season. I just wouldn't necessarily bank on it being within the next week or two. That's all. That's, I guess, kind of how I would approach this. Notice Juwan Jennings is not on my list. So I know he didn't have a big productive game last week, but he had 7 targets. George Kittle's back. I think the days of Kendrick Bourne popping off the screen are probably over at this point with those two back and getting more healthy, even with Ricky Pearsall off the field. So I just wanted to mention that. Another player dealing with concussion, Josh Downs. What do you have here?
Not much. It sounds like he's still in protocol. I don't think he did anything the last couple of days still. So the later you get in the week here, the more difficult it could be. That's I don't really have much more than that on him. Hopefully, but and the issue with this one was that it kind of popped up in a weird time, because he completed the game, and then it sounded like he had concussion symptoms afterwards. There was a play like toward the very end of the game where he took a little hit to the head or something, and then I guess that translated into some concussion type symptoms afterwards, and then lo and behold, as we entered last week, he was on concussion protocol and wasn't cleared to play this past weekend. So we'll see if he's ready this week, but until he gets on the field again, can't get through the protocol without stepping on the field.
No, 100%. And look, I know Alec Pierce has been interesting, and in a match against Tennessee, there's no one here to tell you that he won't be interesting. Like, I have him ranked, though, still more as a wide receiver 4 this week, because it's against the Titans. There's really no reason the Colts are going to have to go outside of Jonathan Taylor, Michael Pittman, and Tyler Warren to take care of the Titans. In fact, I'm actually even a little bit concerned about either Pittman or Warren, because I know who is getting the ball for sure, and that is Jonathan Taylor. And he by himself could just run the Tennessee Titans off the field. 100% possible. So I'm definitely still playing all 3 of those players. I just don't know if there's room for another player outside of a one-shot type of situation to really have a ton of fantasy value heading into this week. So Alec Pierce, he's a desperate play, sure, because of the matchup. It could just take one catch, but there might not be much reason to get him heavily involved either. All right, so let's talk your team a little bit here. Darius Slayton, maybe he's nearing a return?
I don't really care much. He's got to work on his hands before we worry about his hamstring. He had some pretty miserable drop passes the week he played, and then had a hamstring injury, of course.
Can it be worse than Jalen Hyatt, though?
No, they're both kind of equally worse. It didn't sound like it was anything serious, but he's a speed guy, so you're going to want to make sure he's right. It's been about 2 weeks, I think, now since that injury apparently occurred. I think we'll see him just because of the sheer desperation at this position that they need somebody to produce. I think they recently went out and signed a former Saints player or receiver, if I'm not mistaken. I can't remember his name.
No, Tyler Lockett is who you were thinking of.
No, they signed somebody else.
I thought it was Tyler Lockett.
No, I don't think so.
They brought Lockett in for a tryout. That's what it was.
But they ended up going with a former Saints receiver, and I don't remember what his name was. A special teams guy, but also a wide receiver. Anyway, to make a long story short, they need help, and they need him back.
I think we'll see him back. So they signed Ray McLeod, who just got cut by the Falcons.
Right. Sorry, Falcons.
This past week. So absolutely, right.
They need him back. I think it's been enough. It didn't sound like it was anything serious. I didn't get any definitive updates today. I think we'll see him ramp up his activity in practice, though. Slightly shortened season, or slightly shortened week because of the Sunday night game and the travel to Denver. But I think we still should see him get on the practice field, ramp it up with maybe carrying a questionable tag into this weekend's game.
I just bring it up because it's going to be another wide receiver getting added to the mix. Some people have now found themselves riding that nice floor level, wide receiver 3, low end wide receiver 2 value Wan'Dale Robinson has been providing since becoming the top wide receiver. Darius Slayton's not going to change it. If anything, he might actually help it, because the big thing that this Giants offense needs right now is somebody that defenses have at least a little bit of fear of actually taking the top off the field and having a little respect for that. So I think if anything that would actually benefit, this is not going to be a target takeaway from Wan'Dale Robinson in any form or fashion, in my opinion. What's going on with Christian Watson? I was hearing movement like maybe he could be active this week.
Well, yeah, it sounds like there's some good news on the horizon here. I think they've officially opened up his 21-day practice window coming off IR, and he should be ramping it up. I don't necessarily know if we'll see him just yet, but optimistic that he should be back anytime. He's got some limited work at practice the last few days, as far as I know. He's continuing with his rehab. I don't know if he's gotten a full day in yet. I would expect to see multiple full practice days before they throw him out in a game situation. So I don't know if we're going to see him this week, but he's officially in that window. They've got 21 days to activate him, and I think we'll see that happen probably next week.
Well, it was interesting that if it is this week, because people are gonna ask me this, Brian, so that's why I bring it up to you. If it is this week, then Tavian Wicks, who's dealing with the calf issue, doesn't look like he's going to play.
Yeah, so, and I think he didn't even practice today or yesterday. So yeah, that could be factoring into what the decision about what they do treating him. Maybe not. I don't know. But I would. If I was them, I wouldn't be so quick to throw Watson back out there. The guy's had a lot of issues over the years with hamstring stuff, and some various other injuries that have kept him on and off the field throughout the last 2 seasons, dating prior to this knee injury. This is not something you want to throw them out there. I need to see what Christian Watson can give me before I feel comfortable getting him back on the field. And that's why I say I need to see him get some full practice sessions in. I need to see what he can do on the practice field. Now, does Dontavian Wicks' injury speed that up a little bit? Perhaps. But they've known that Christian Watson is going to be somebody that they're going to have to, kind of monitor throughout the year, and didn't really have a set time frame as to when he'll be back. So I feel like they're going to use at least a few more days, maybe another week into this 21-day window before making the decision on him. And they'll treat Wicks accordingly, hoping that he'll be ready to go sooner rather than later.
Yeah, remind me again, the Christian Watson ACL injury, was that a clean tear or no?
As far as we know, it was. The issue with him, though, was he had a lot of other injuries that predated this ACL injury, including multiple hamstring injuries. I think it might have been to both legs, and so much so that they were considering at one point surgery, and then he was working with a specialist in Wisconsin who dealt only with hamstring injuries and hamstring training regimens, and had been on this. This is going back now 2 seasons, I believe.
Sure.
But, so that that I'm sure that factored into maybe what they found surgically when they were repairing his knee. It may have contributed to his injury in the first place, which is kind of concerning if that's true. So yeah, I mean, that's what I'm saying. Like, I don't think whether he had a straightforward ACL or any other ligament injury or a mechanical structural injury there, I think they're going to just be cautious with him coming back too soon. So I think we need to see him get some full days in.
Well, I'm with you. I wouldn't trust it until we saw him get some full days in. I wouldn't trust it until I saw him play in a football game, because to your point, I got to see what he even looks like. Does he still have his juice? Because he's a guy who is being dependent on being a big play wide receiver. I know I'm going to get asked the question, because people are like, well, it's Byemageddon. I got a bunch of guys hurt. I got a bunch of guys on bye. Yeah. Can I plug and play Christian Watson if he plays with Dontavian Wicks out and hope that I get a big play? My answer to that is no. I would not play him no matter what this upcoming week, even if he is out there and active. But I did want to ask you that question, because maybe it gives you a little bit of a better chance that it's something that, while it can't be not going to be the first week back, that maybe sooner rather than later, like maybe this season, if he does have that juice left, that we might actually get to see it this year. We're guys like, like Brandon Ayuk, where I still worry, like, even when he does come back, I don't know what he's going to have because it was such a bad ACL injury. If he's even going to look remotely like himself, even when he does return this season, Watson may not be quite to that level. I just did that to bring that part up. All right, so let's dive into the tight ends here. Darren Waller dealing with the pec issue. That didn't take long. What do you got?
He's officially on IR. You have to, this guy came out of retirement. Let's not forget, to play for the Dolphins this year. Was trying to make a music career out of his retirement, and then found himself back on the field. I'm not really sure what to make of this. I didn't see the injury. I don't know how severe this is. I haven't heard reports that he had to have surgery for this. It could just be a strain. Even so, it's pretty debilitating injury if it's significant. Your pec muscle, basically your chest, is involved in a lot of movement, and blocking at the tight end position is important. I mean, it can be very debilitating. It can really affect your game. So it must have been pretty severe because he went on IR pretty quickly. Now the question is he coming back at all? Or is this going to be like the nail in the coffin as far as his retirement goes? I don't know. We'll have to see.
Yeah, this is just, typical of Darren Waller. He gets your hopes up, and then he gets into it. So,
that too.
We're just back up where we kind of picked up from. Yeah. Go ahead and drop him. Even if he does come back this season, I don't care. Go ahead and just drop him. All right, so David Njoku. So this was actually sounding more positive than I was expecting it to sound for this week.
Well, then you might have more news because I didn't get much of an update. I didn't see that he practiced unless he practiced today. Okay, well that's encouraging.
So he was limited yesterday and he was limited again today. Okay. I wasn't expecting him to practice at all.
Well, I mean, I still don't know if we're going to see him this weekend. I think it might be at least another week. The fact that he's stepped up back on the field, though, is encouraging, like you said, and optimistic. But depending on the severity of this knee sprain that he had, and they haven't been too specific either about what exactly he injured, just that it was his knee, I think we'll probably see him next week, though. If he can keep getting some limited sessions in the rest of this week and possibly carry a questionable tag or out this weekend, I think we will see him ramp it up and be available the following week. And I don't think when do they have their bye?
I have to look at that
Browns,
one.
I got it right in front of me here. Did they have? I think they had their week 9, so we might not see him until
next week
after the bye, maybe.
Yeah, that would track and make sense. Mm-hmm. So, first of all, he was ruining my ranking because I had Harold Fannin in my top 6 of tight ends this week, and I was like, dude, I finally wanted to get like Harold Fannin up there and like a must lock him in play, and then you had to practice. Like, why? But yeah, so here's the one thing I'm going to say about David Njoku. We have seen him come back on some crazy timetables in his day when we expected him to be out. So I would never count this guy out any given week, especially if he's able to get onto a practice field. Like, there are a few guys as tough as David Njoku when it comes to that kind of thing.
Yeah.
So I would put that out there. But if he is out, I am locking in Harold Fannin. If he gets back out there, I still think Fannin falls into the streaming territory, but it just wouldn't be quite as locked in. I would still have Fannin over Njoku, even Njoku does play this week. All right, so Dalton Kincaid, they had their bye week, and yet he's still seemingly kind of limited in practice with his oblique issue.
Yeah, I would have expected that to get a lot better by now. I still think we'll probably see him this week. He may still carry a questionable tag right up until the last minute here. We might get an answer on Friday depending on what he's able to do. But with the bye week, I would think he had enough time to recover.
It's a good matchup. So if he's out there playing him, especially this week, he'll be in my top 10. Is it wide variance with Dalton Kincaid? Yeah, because it's wide variance with every Buffalo Bills pass catcher because it's a super spreader offense and Josh Allen locks into no man. And I still question about Dalton Kincaid being a top 12 tight end the rest of the way. A lot of people seem to be much higher on him. And I get that before he had the injury in the bye week, he had like 6 catches for like 100 yards. Here's the problem. Kincaid flat out doesn't play enough. He's not on the field enough to sustain top 12 fantasy football productivity, even for the tight end position. That's the issue. Dawson Knox is out there. Jackson Hawes was getting out there in certain situations now too. Is he going to have these blow-up moments? Yeah, because he is with Josh Allen and he is a decent pass catcher. But until he ever gets to the point where he's getting 80% of the routes, you're never going to be able to trust him on a week-in, week-out basis. But this is a matchup as long as he plays against the Carolina Panthers and the week that we're in. that you can go ahead and play him as a top 12 option. All right, so last guy I want to talk about is Cole Kmet dealing with a back issue. Do you have any updates here?
Not much. It sounds like he's still kind of getting treatment. I don't think he's been on the practice field as of yet. It sounds like this could be at least another week. And when do the Bears? Let me check their bye week too, because
they had their bye week already in week 5.
So that doesn't help his situation, unfortunately. So I don't foresee him coming back on the field if he can't get on the practice field with this back issue. Back injuries can be very debilitating, unfortunately, and that's the problem. It can be difficult to prepare yourself for a game until your back is 100%. And these injuries can even more easily be aggravated like a hamstring, but worse. It doesn't take much, unfortunately. We're talking about your core is typically the lower back that gets affected, and those injuries could be really, really problematic for guys trying to get back on the field. So this could extend to a several-week issue. I wouldn't expect him back this week. But, Dan, one guy you didn't mention who I will bring up is Brock Bowers. There's some reports saying that we should see him when the team comes back from their bye next week, week 9.
No, that's a good update. I didn't put him on here because they are on bye week, but that's a good update that he should be back and ready to go.
So it sounds like he's trending in the right direction. Him and Jacoby Myers both should be back. I think we talked about that as well. There's no reason to rush a guy like him back with a bone bruise that he was dealing with and a PCL injury, which is even more significant than Ricky Pearsall's. Or maybe they're about the same. Maybe that's why Pearsall's struggling too. But they did the right thing. They kept him out until after their bye. It sounds like he's doing great and should ramp up his activity. We should see him next week. So that's a good sign for that tight end.
And there's no reason to rush him back when, again, it's another team that's an atrocity. So, how much do you want to play a guy in that situation? Just to piggyback on the Cole Kmet situation real quick. First of all, back issues suck. You're a tight end. You're asked to block and be a receiver. It's a very difficult injury to manage, especially if it is significant. Colston Loveland owners are seething right now. Like, finally, this is the opportunity we've been waiting for. Look, it is a good match against the Baltimore Ravens. He should get more playing time with Cole Kmet, which has been the biggest hindrance to him actually doing anything. But there's also an element here where it's clear one of the reasons he hasn't been playing as much is that they don't trust him to block. And he wasn't a good blocker in Michigan. I brought that up too. He's never graded out well. He's not a power blocker. He's fine as a flanker blocker. Like, put him up in a corner. Sure, he's bigger than the other guy. He might be able to swallow him up and get in the way. But they might find reasons to not put him on the field as much as you would want him to. Remember, Luther Burden is still not playing as significantly as he should, and they're not even utilizing DJ Moore. That's not even holding Luther Burden back. Right now, the only guy who plays consistently as far as the pass catchers are concerned are Rome Odunze, and he's a little bit of a cold streak. Yes, it's the Baltimore Ravens. Yes, it's a matchup where I would want to play Rome and Caleb and, of course, DeAndre Swift and all of that. But I would still think you might have a better option than Colston Loveland for this week. Wait to see if they actually trust him enough with Cole Kmet out and playing enough before you go ahead and just plug and play him in. DFS, take a shot, fine, go for it. Your redraft leagues, maybe wait one more week. That's going to do it for the show for today. I hope you guys all enjoyed it. Brian, love having you on as always. What do we got to check out that you have coming up right now?
Yeah, so I've been doing these Tuesday morning podcast episode releases on our YouTube channel at That Sports Podcast Network and wherever you find your podcast shows. That the injured list, as you can see in the back here, those seem to be very popular. They're picking up in popularity. I think it's important because it gives you just a little bit more of an advantage earlier in the week, coming off the weekend. We'll touch upon some injuries that occurred Sunday and Monday night, and even update some injuries that maybe have occurred on the Thursday night game from the weekend and the week prior. So it gives you a little bit more of an advantage, helps you kind of later in the week listen to Operation Domination and figure out if maybe you made the right move or maybe you didn't, as we get more information as the week unfolds. So that's been kind of my little pet project this season I'm working on. So I release that every Tuesday morning. And then, of course, Operation Domination Fridays, TSS Fridays, and Sundays, doing my thing.
All right. Love it, love it, love it. Speaking of Operation Domination, download us on your favorite podcast app and check out our video content when you go to the Fantasy Football Advice Network YouTube channel at FF Advice Net. As always, I'm your host, Dan Mader. I'll be back, or it might be Adam back. We got to figure that out part first. But it will be a Week 8 best with guest Chaz Flaherty from Sports Betting Weekly, as it always is. So make sure you guys tune in for that. And until then, be good.